video is to demonstrate donning and doffing for level 3-4 pathogens. Each step will be read before the PPE is donned or doffed. There will be an observer and a healthcare provider. The observer will don their PPE followed by the healthcare provider. The healthcare provider will doff their PPE followed by the observer. The observer's job is to ensure that the healthcare provider is safe at all times. They will direct the donning and doffing of the healthcare provider's PPE and will remind the healthcare provider not to rush. They will watch the healthcare provider at all times from outside the client room. The healthcare provider will direct the donning and doffing of the observer's PPE. They will also be the only one to go into the patient's room if dressed in full PPE and when the observer dressed in full PPE is present. Off your face and your neck. Remove any extra items, such as your jewelry or your name tag, and you can put them in the graduated cylinder here. Perform hand hygiene. And if you need a reminder, you can look at the sanitizer poster. Okay, sit in the chair. Next thing you're going to do is you're going to put on shoe covers. So I'm going to get you to get 2 shoe covers. So the first thing you're going to do is lift your toe and pull the shoe cover over your toe. Place your toe down and lift your heel to put on the rest of the shoe cover. Making sure your laces are tucked in. Then you're going to repeat with your other foot. So lift your toe and pull the shoe cover over your toe. Then place your toe down, lift your heel to put on the rest of the shoe cover. And tuck in your laces. Now you're going to perform hand hygiene. So now you're going to put on an isolation gown. I will tie the neck and the waist for you. So I'll make sure there's no gaps. Can you turn around for me? Lift your arms. Perfect. Now you're going to put on a face shield. You're going to place the foam piece above your brow. And then the strap around the back, and I'm going to make sure there is nothing twisted. Does it feel comfortable?
Yep.
Now you're going to put on gloves, making sure that the cuffs are pulled over the cuffs of your gown. Inspect for tears. Okay, just going to take one more look around and make sure everything's in place. Turn around. Great. Okay.
Okay, so ensure your hair is pulled back and secured off your face and neck. Remove any extra items like jewelry, watches, stethoscopes, ID tags, pages, pagers, phone, and place them in the graduated cylinder. Perform hand hygiene and we'll switch spots. Now we'll put on your knee-high boot covers. So sit in the chair. Grasp the top of the boot cover and reach down to the ankle elastic. Lift your toe and stretch the ankle elastic as you cover your toe. Place your toe down and lift your heel, and then pull the boot cover over your heel to your knee. And we'll do the same thing with your other foot. So grasp the top of the boot cover and reach down to the elastic. Lift your toe and stretch the ankle elastic as you cover your toe. Place your toe down and lift your heel, then pull the boot cover over your heel up to your knee. Now perform hand hygiene, please. Next we'll put on your N95. So remove your glasses and place them in the graduated cylinder. And then put your N95 on using the OHS instructions. Now we're going to put the glasses back on. Just make sure you don't push them on to fit so you don't break the seal of the N95. Next, put on gloves. Now inspect your gloves for tears. Okay. Next we'll put on the hood. So you're going to place the hood securely on your head, covering your ears and hair. I'll make sure the hood is lying flat across your shoulders. Cross the ties at the front and pass them behind your neck to me and I will tie them. Turn around. Okay. Put on surgical gown. You want to make sure your gloves remain under the top of the gown. Ensure the collar of the hood is tucked under your gown. I will do the ties. The Velcro at the neck, and then the inner tie, and the outer tie. I'll ensure that the ties are tight to ensure there is no gaping. Looks good. Good. I'll put on second set of gloves. These gloves are worn over the gown cuff. Now we'll put on your face shield. Place the foam piece above your brow and place the band at the crown of your head. Ensure your N95 is not adjusted while placing the face shield. I will inspect placement to make sure the band is flat without any twists. Turn around. Okay, looks good. Now inspection and range of motion. I will inspect your PPE for tears, gaps, and proper placement and will adjust it as needed. Perform range of motion activities to ensure your PPE stays in place. Lean forward, gently shake your head, perform a squat, fully extend your arms. Okay, that's good. Avoid touching your face or adjusting your PPE once you're in the client room. Knock on the door as a signal that you are ready to leave the client room. Exit client room. I will open the door for you. Inspect PPE and remove visible soil. I will visually inspect your PPE for contamination or tears. If any PPE appears contaminated, I will give you a wipe to disinfect the contaminated area. Okay, everything looks okay. Remove outer gloves. Minimize direct contact with inner gloves. First, glove to glove, and discard. Second, glove to cuff, and discard. Now we'll remove your surgical gown. I will undo your gown. I will unfasten the Velcro at the neck and outer waist and inner ties. I will keep a side view of you as you remove your gown. Slide 2 fingers under the cuff of the gown and pull your hand into the gown, making a claw shape that is covered. Using the clawed hand, grab your other sleeve and pull it over your hand. Roll the gown outside in, away from your body. When it becomes small enough, discard it. Now we'll remove your inner gloves. First, glove to glove, and discard. Second, skin to skin, and discard. Now perform hand hygiene. Next we'll put on new gloves. I will pass you your gloves. Inspect your gloves for tears. Next we'll remove your knee-high boot covers. Sit on a chair. Grasp the boot cover on the outside only. Do not touch your pant leg. Roll the top edge down to your ankle. Stretch the elastic over your shoe. Lift your heel, keeping your toe planted, and slip the boot cover off your heel. Lift your toe, keeping your heel planted, and slip the remaining boot cover off the front of your shoe, and discard. Repeat with your other boot cover. Stretch the ankle elastic, or roll the top edge down to your ankle. Stretch the ankle elastic over your shoe. Lift your heel, keeping your toe planted, and slip the boot cover over your heel. Lift your toe, keeping your heel planted, and slip the remaining boot cover off the front of your shoe. Discard. Next, remove your gloves. First, glove to glove, and second, skin to skin. Discard. Now perform hand hygiene. Now we'll put on new gloves. I will pass you a new set of gloves. Inspect your glove for tears. Remove face shield. Handle your face shield only by the elastic band. Grab the band at the sides of your head and above your ears. Stretch out the band and gently lift up and over your head, allowing the face shield to fall forward. And discard. Now we'll remove your gloves. First, glove to glove and discard. Second, skin to skin and discard. Perform hand hygiene. Now we'll remove your surgical hood. I will undo the hood ties and drape them down on the front of the hood. I will grasp the hooded material at the shoulders in one hand. I'll gently use my other hand to grasp at the top of your head. Pull away from your head. I'll place the hood cover in the garbage. Ensure you do not touch your face. I will doff my gloves, perform hand hygiene, and don a new set of gloves. Next, we'll remove your N95. Ensure you do not touch your face or the front of your N95. Remove your glasses and place them in the graduated cylinder. Remove your N95 using the OHS instructions. And discard it. Perform hand hygiene and then put your glasses back on. I will pass you a new set of gloves to put on. Now we're going to disinfect your shoes. So sit on the second chair. Ensure you don't sit in the same chair as you did to remove your boot covers, as it is contaminated. I will give you a wipe to disinfect each shoe. Wipe the tops, sides, and bottom of each shoe, and discard. Now remove your gloves. First, glove to glove, discard, and second, skin to skin. And perform hand hygiene.
Okay, now we're going to clean the doffing area. I want you to pick up any PPE or any wipes that are on the floor, holding them away from your body, and discard them into the garbage. Then please mop the floor, moving from the cleanest to the dirtiest, starting at the exit of the anteroom to the exit of the client's room. Once the floor has dried, I will pass you wipes and you will disinfect the following things: the handle of the mop, the chairs. The outside of the alcohol and-based rub and the outside of the wipes container and the door handle. Okay, so now you're going to remove your gloves using the glove to glove, discard, and skin to cuff. Perform hand hygiene. Next thing, you're going to remove your isolation gown, and I will undo the gown, starting at the top and then the waist. Okay, just wait. Now what I'd like you to do is turn around so I can see you. Slide 2 fingers under the cuff of the gown and pull your hand in there, making a claw shape. And with that claw shape, you're going to pull that gown over that hand. And then roll the gown outside in away from you, touching the inside. When it becomes small enough, discard it and perform hand hygiene. And when your hands are dry, put on new gloves. And get a new glove. Inspect for tears. Okay. So what you're going to do is remove your shoe cover. So you sit on the chair, stretch the ankle elastic over your shoe, lift your heel, keeping your toe planted, and slip the shoe cover off your heel. Lift your toe, keeping your heel planted, and slip the remaining cover off the front and discard. And we're going to repeat with the other. So stretch the ankle elastic over your shoe, lift your heel, keeping your toe planted. Lift your toe, keeping your heel planted, and slip the shoe cover off the front of your shoe. Discard. Now we're going to remove your gloves. First, glove to glove, and skin to skin. And perform hand hygiene. Okay, and put on new gloves. So you're going to remove your face shield. Handle your face shield only by the elastic band. So go right by your ears, just above your ears. Pull that band away, grasping stretch, and pull out and away, leaning forward. Discard. Now you're going to remove your gloves, glove to glove, skin to skin. And perform hand hygiene. Perfect.